Hello, welcome to Crush Medicals. In this video, we will be talking about in vitro fertilization, or IVF. IVF stands as a beacon of hope for countless couples yearning to experience the joys of parenthood. This revolutionary technology has radically transformed the landscape of reproductive medicine, offering a lifeline to those grappling with the heartbreak of infertility. IVF involves a meticulously orchestrated series of procedures designed to facilitate conception outside the womb. Today we delve into the intricacies of IVF, exploring its steps, success rates, risks, ethical considerations, and the profound impact it has on the lives of individuals and families. For many, the journey to parenthood is fraught with challenges. Infertility, a deeply personal and often isolating experience, affects millions of individuals and couples worldwide. The inability to conceive naturally can be a source of immense emotional distress, leading to feelings of inadequacy, frustration, and grief. IVF offers a ray of hope in these circumstances, empowering individuals and couples to take control of their reproductive destinies and pursue their dreams of having a family. The development of IVF marked a paradigm shift in reproductive medicine. It opened up new avenues for couples who had previously resigned themselves to a life without children. The ability to fertilize eggs outside the body and subsequently transfer embryos into the uterus revolutionized infertility treatment. Since the birth of Louise Brown, the world's first IVF baby, in 1978, IVF has become an increasingly mainstream option for couples struggling to conceive. IVF's impact extends far beyond the realm of medicine. It has sparked widespread societal conversations about infertility, adoption, and the very definition of family. IVF has challenged traditional notions of parenthood, paving the way for greater inclusivity and acceptance of diverse family structures. By providing a means for same-sex couples, single parents, and individuals with genetic disorders to experience the joys of raising children, IVF has helped redefine what it means to be a family in the 21st century. Infertility, a condition that affects millions of couples worldwide, is defined as the inability to conceive after 12 months of regular, unprotected intercourse. It is a complex issue with a myriad of potential causes, affecting both men and women equally. Female infertility can stem from a variety of factors, including ovulation disorders, tubal blockages, endometriosis, uterine fibroids, and age-related decline in egg quality. Male infertility, on the other hand, is often attributed to low sperm count, poor sperm motility, abnormal sperm morphology, or blockages in the reproductive tract. In some cases, the underlying cause of infertility remains elusive, leaving couples with a diagnosis of unexplained infertility. This can be particularly frustrating as it makes it challenging to develop a targeted treatment plan. However, advancements in reproductive medicine continue to shed light on the complexities of infertility, leading to more effective diagnostic tools and treatment options. Lifestyle factors can also play a significant role in fertility. Smoking, excessive alcohol consumption, drug use, obesity, and exposure to environmental toxins can all negatively impact both male and female fertility. Maintaining a healthy weight, eating a balanced diet, exercising regularly, and managing stress levels are essential for optimizing fertility. Fortunately, numerous treatment options are available for couples struggling with infertility. These range from lifestyle modifications and medications to advanced reproductive technologies like IVF. The choice of treatment depends on the underlying cause of infertility, the couple's age and medical history, and their personal preferences. IVF, while not a guaranteed solution, offers a beacon of hope for couples who have been unable to conceive through other means. The IVF process is a multi-step journey that requires careful coordination between medical professionals and patients. It begins with a comprehensive evaluation of both partners to assess their overall health and identify any underlying fertility issues. Once the couple is deemed suitable candidates for IVF, the treatment cycle can commence. The first step involves ovarian stimulation, where the woman takes fertility medications to stimulate her ovaries to produce multiple eggs. During ovarian stimulation, the woman undergoes regular monitoring through blood tests and ultrasounds to track the growth and development of her follicles, which are fluid-filled sacs in the ovaries that contain eggs. Once the follicles reach maturity, a trigger shot is administered to induce ovulation. Egg retrieval is then scheduled approximately 36 hours later. During egg retrieval, the woman is placed under sedation and a thin needle is guided through the vagina and into the ovaries to aspirate the mature eggs. After the eggs have been retrieved, they are transported to the laboratory, where they are fertilized with sperm from the male partner or a donor. Fertilization can be achieved through conventional insemination, where the eggs and sperm are placed together in a petri dish, or intracytoplasmic sperm injection, or ICSI, where a single sperm is injected directly into each mature egg. ICSI is often recommended for couples with male factor infertility, or in cases where previous IVF cycles have resulted in fertilization failure. Following fertilization, the embryos are carefully monitored in a controlled laboratory environment. The embryologist assesses their growth and development, selecting the healthiest embryos for transfer. Embryo transfer typically takes place 3 to 5 days after fertilization. During the procedure, the selected embryos are loaded into a thin catheter, which is then gently inserted through the cervix and into the uterus. The number of embryos transferred is a crucial decision that is made in consultation with the physician, taking into account factors such as the couple's age, the quality of the embryos, and their previous IVF history. Ovarian stimulation is a crucial step in the IVF process, as it aims to stimulate the ovaries to produce multiple mature eggs. This is essential because not all eggs retrieved will be successfully fertilized, and not all fertilized eggs will develop into viable embryos. By increasing the number of available eggs, ovarian stimulation enhances the chances of achieving a successful pregnancy. The medications used for ovarian stimulation work by mimicking the hormones naturally produced by the body during the menstrual cycle, namely follicle-stimulating hormone, or FSH, and luteinizing hormone, or LH. These hormones stimulate the growth and development of multiple follicles within the ovaries, each containing an egg. The type and dosage of medications used for ovarian stimulation vary depending on individual factors such as age, ovarian reserve, which is the quantity and quality of eggs remaining in the ovaries, and previous response to fertility medications. During ovarian stimulation, women are closely monitored to assess their response to the medications and to minimize the risk of complications. Regular blood tests are conducted to measure hormone levels, and ultrasounds are performed to track follicle growth and development. This monitoring allows physicians to adjust medication dosages as needed to optimize egg production and prevent adverse effects. Ovarian stimulation is a critical but demanding phase of the IVF journey. It requires frequent clinic visits, blood tests, and injections, which can be physically and emotionally taxing. However, the potential rewards of ovarian stimulation, namely an increased chance of achieving a successful pregnancy, make it a worthwhile endeavor for many couples seeking to overcome infertility. Section 5. Egg retrieval and fertilization crucial steps in the IVF journey. Egg retrieval is a minimally invasive surgical procedure performed under sedation to collect the mature eggs from the ovaries. It typically takes place 34 to 36 hours after the administration of the trigger shot, which induces ovulation. During the procedure, a thin needle is guided through the vagina and into the ovaries using ultrasound guidance. The needle is connected to a suction device that gently aspirates the follicular fluid containing the eggs. Once the eggs have been retrieved, they are immediately transported to the laboratory, where they are examined under a microscope by skilled embryologists. The embryologists identify and isolate the mature eggs, which are then prepared for fertilization. Fertilization can be achieved through conventional insemination or intracytoplasmic sperm injection, or ICSI, depending on the specific circumstances of the couple. Conventional insemination involves placing a concentrated sample of sperm from the male partner or a donor into a petri dish containing the mature eggs. The eggs and sperm are then left to incubate together, allowing fertilization to occur naturally. ICSI, on the other hand, involves injecting a single sperm directly into the cytoplasm of each mature egg. This technique is often recommended for couples with male factor infertility, as it bypasses any potential barriers to fertilization that may exist in the male reproductive tract. Fertilization is a critical milestone in the IVF process, marking the union of sperm and egg to create an embryo. The fertilized eggs, now called zygotes, are carefully monitored in the laboratory for signs of fertilization, such as the presence of two pronuclei, one from the sperm and one from the egg. The zygotes that successfully fertilize will then undergo cell division, developing into embryos. Section 6. Embryo development and selection. Choosing the best chance for life. Following fertilization, the embryos are carefully cultured in a controlled laboratory environment that mimics the conditions of the female reproductive tract. The embryologist monitors the embryo's development over the next several days, assessing their growth rate, morphology, and any signs of fragmentation. Embryo selection is a crucial step in the IVF process, as the goal is to identify the embryo or embryos with the highest potential for implantation and a healthy pregnancy. Embryologists use a variety of criteria to assess embryo quality, including the number of cells, the rate of cell division, the symmetry of the cells, and the degree of fragmentation. Traditionally, embryo selection has been based on visual assessment using a microscope. However, advancements in time-lapse imaging technology have revolutionized embryo selection. Time-lapse systems allow embryologists to continuously monitor embryo development, capturing images of the embryos at regular intervals. This provides a dynamic view of embryo development, enabling the identification of subtle morphological changes that may not be apparent with traditional static observation. The number of embryos selected for transfer is a crucial decision that is made in consultation with the physician, taking into account factors such as the couple's age, the quality of the embryos, and their previous IVF history. Transferring multiple embryos increases the chances of pregnancy, but also raises the risk of multiple gestations, twins, triplets, or more. Multiple gestations carry increased risks for both the mother and the babies, including preterm birth, low birth weight, and pregnancy complications. Section 7. Embryo transfer. The hopeful wait begins. Embryo transfer is a relatively simple and painless procedure that marks the culmination of the IVF laboratory phase. It typically takes place 3 to 5 days after fertilization, depending on the stage of embryo development and the clinic's protocols. During the procedure, the selected embryo or embryos are loaded into a thin catheter, which is then gently inserted through the cervix and into the uterus. The number of embryos transferred is a crucial decision that is made in consultation with the physician, taking into account factors such as the couple's age, the quality of the embryos, and their previous IVF history. Transferring multiple embryos increases the chances of pregnancy, but also raises the risk of multiple gestations. Multiple gestations carry increased risks for both the mother and the babies, including preterm birth, low birth weight, and pregnancy complications. After embryo transfer, the woman is typically advised to rest for a short period before returning home. She may be prescribed progesterone supplementation to support the uterine lining and increase the chances of implantation. The wait after embryo transfer can be an anxious time for couples as they eagerly await the results of the pregnancy test, a blood test to measure levels of human chorionic gonadotropin, a hormone produced during pregnancy, is typically performed about 10 to 14 days after embryo transfer. A positive HCG test indicates that implantation has occurred and the woman is pregnant. If the pregnancy test is positive, an ultrasound will be scheduled a few weeks later to confirm the pregnancy and check for a heartbeat. Section 8 IVF. Success rates, navigating the numbers. IVF success rates vary widely depending on a multitude of factors, including the age of the woman, the cause of infertility, the clinic's experience and success rates, and the number of embryos transferred. It's important to note that success rates are not a guarantee of success or failure for any individual patient, but rather provide a general idea of the likelihood of achieving a live birth with IVF. One of the most significant factors influencing IVF success rates is the woman's age. Female fertility naturally declines with age, primarily due to a decrease in the quantity and quality of eggs. As women age, their eggs accumulate more genetic abnormalities, making them less likely to fertilize and develop into healthy embryos. Consequently, IVF success rates are highest for women under 35 and gradually decline with advancing age. The underlying cause of infertility also plays a role in IVF success rates. Couples with tubal factor infertility, where the fallopian tubes are blocked or damaged, tend to have higher success rates with IVF compared to couples with other causes of infertility, such as endometriosis or male factor infertility. This is because IVF bypasses the fallopian tubes entirely, allowing fertilization and embryo development to occur in the laboratory. The clinic's experience and success rates are also important considerations when choosing an IVF center. Clinics with higher success rates often have more experienced embryologists, state-of-the-art laboratory facilities, and rigorous quality control measures in place. It's essential to research different clinics, compare their success rates, and inquire about their experience treating patients with similar infertility diagnoses. Section 9. Risks and considerations, weighing the pros and cons. While IVF offers a viable path to parenthood for many couples struggling with infertility, it's crucial to be aware of the potential risks and considerations associated with this complex procedure. As with any medical treatment, IVF carries both physical and emotional risks that should be carefully weighed against the potential benefits. One of the primary concerns associated with IVF is the risk of multiple gestations. Transferring multiple embryos increases the chances of pregnancy, but also raises the likelihood of having twins, triplets, or more. While some couples may welcome the prospect of having multiples, it's important to understand the increased risks associated with multiple pregnancies, including preterm birth, low birth weight, gestational diabetes, preeclampsia, and cesarean delivery. Ovarian hyperstimulation syndrome, OHSS, is another potential complication of IVF that can occur as a result of ovarian stimulation. OSS occurs when the ovaries become overstimulated by the fertility medications, leading to the development of multiple large cysts. Symptoms of OSS can range from mild bloating and discomfort to severe abdominal pain, nausea, vomiting, rapid weight gain, and shortness of breath. In addition to the physical risks, IVF can also take an emotional toll on individuals and couples. The process is often physically and emotionally demanding, requiring frequent clinic visits, blood tests, injections, and the uncertainty of outcomes. The stress of infertility treatment, coupled with the hormonal fluctuations associated with IVF medications, can lead to mood swings, anxiety, depression, and relationship strain. Section 10. Ethical dilemmas, the complexities of assisted reproduction. The advent of IVF and other assisted reproductive technologies, RT, has ushered in a new era of ethical dilemmas surrounding reproduction and family building. As technology continues to advance, it pushes the boundaries of what is medically possible, raising profound ethical questions about the very nature of parenthood, the allocation of healthcare resources, and the potential for genetic selection and enhancement. One of the most contentious ethical issues surrounding IVF is the fate of surplus embryos. IVF often results in the creation of more embryos than are needed for transfer, leaving couples with the difficult decision of what to do with the remaining embryos. Options include cryopreservation, freezing for future use, donation to other infertile couples, or for research, or thawing and discarding. The ethical considerations surrounding embryo disposition are complex and deeply personal, often reflecting religious beliefs, moral values, and societal norms. Another ethical concern relates to the use of pre-implantation genetic testing, PGT, a procedure that allows for the genetic screening of embryos before transfer. PGT can be used to identify embryos at risk for specific genetic disorders, ensuring that only healthy embryos are transferred. However, PGT raises ethical questions about selective abortion, designer babies, and the potential for genetic discrimination. The increasing availability and affordability of IVF have also raised concerns about the potential for exploitation and the commodification of reproduction. For example, some critics argue that the use of egg donors and surrogates, while providing a valuable service to some, raises concerns about the exploitation of women, particularly those from disadvantaged backgrounds who may be motivated by financial need. Section 11. Personal Stories, Triumph and Hope in the Face of Infertility. Behind the science and statistics of IVF lie countless personal stories of hope, resilience, and the unwavering human spirit. Every IVF journey is unique, marked by its own set of challenges, triumphs, and ultimately, the profound desire to create a family. These personal narratives offer a glimpse into the emotional roller coaster that is IVF, highlighting the strength, courage, and unwavering determination of those who embark on this extraordinary path to parenthood. For Sarah and Tom, their IVF journey was a testament to their unwavering love and commitment to building a family. After years of struggling to conceive naturally, they decided to explore IVF. The process was emotionally and physically taxing, requiring countless injections, doctor's appointments, and the heartbreak of a failed cycle. However, their determination never wavered, and on their third IVF attempt, they finally received the news they had been longing for. Sarah was pregnant. Today, they are the proud parents of twin girls, a testament to their resilience and the transformative power of IVF. For Emily, a single woman in her late 30s, IVF offered a chance to fulfill her lifelong dream of becoming a mother. Undeterred by societal norms and the challenges that lay ahead, Emily embarked on her IVF journey with courage and determination. She chose to use donor sperm and underwent several rounds of IVF before finally becoming pregnant. Her son, now a thriving toddler, is a constant reminder of her strength, independence, and the boundless love of a parent. These stories represent just a fraction of the countless individuals and couples whose lives have been touched by IVF. They serve as a powerful reminder that while the journey may be arduous, the rewards are immeasurable. IVF offers hope, empowers individuals to take control of their reproductive destinies, and ultimately helps create families filled with love, laughter, and the miracle of life. Please note that this message is for health enlightenment only and not a medical advice. If you have a medical challenge, kindly contact your healthcare provider. Subscribe to Crush Medicals for more health tips.